Ooh. Ah. Good morning. What the? What is going on with me?
So, you may be wondering what is going on here. Well, let me explain. Every day, you, the dedicated healthcare workers, put your heart and soul into caring for others. But did you know that a tiny, seemingly harmless bacterium could pose a risk to both you and your patients? Introducing Staphylococcus aureus, or S. aureus for short, a gram-positive bacterium commonly found on human skin, especially in areas like the nose, armpit, groin, and more. While these germs may not always cause harm, they have the potential to make you or your patient sick under the right circumstances.
Let's look at it microscopically. S. aureus is a gram-positive bacteria, cocci-shaped, and tends to be arranged in clusters, or a grape-like formation. Its mechanisms for evasion include the production of an anti-phagocytic capsule, sequestering of host antibodies or antigen, masking by protein A, biofilm formation, intracellular survival, and blocking chemotaxis of leukocytes.
S. aureus is part of the normal microbiome, however, it is also an opportunistic pathogen. It waits for the right opportunity to invade and wreak havoc, mainly starting from contact with contaminated surfaces.
While S. aureus often starts as a mild skin infection, it can escalate into more severe respiratory or bloodstream infections, especially in individuals with high risk factors.
I better get to the hospital.
Let's ride. Let's ride.
As you can tell, Miguel has many lesions on his arms and woke up with red eyes. These are early symptoms of Staphylococcus aureus skin infection. Miguel is lucky that his symptoms are surface level, which means that his infections has not spread into the deeper systems of the body, such as his bloodstream, respiratory, or GI tract.
Hi Miguel, what seems to be the problem?
Doctor, I have abrasions on my arm and my eyes are red.
Okay, so let's diagnose.
Coagulase testing is the single most reliable method for identifying Staphylococcus aureus. Coagulase production can be detected using either the slide coagulase test or the tube coagulase test. In this case, Dr. Angelo would take a sample of his blood and test the blood plasma for any clumping. However, in Miguel's case, the bacteria may not be detected in his blood, so culture tests may be performed by swabbing the lesions on his arm or by drawing blood at the specific site of infection.
So how did this happen?
Well, doctor. Oh my, I got a cut, abrasion, lesion. Ah, my arm! I got a cut.
As previously mentioned, risk for Staph aureus infections may increase from poor wound hygiene, but direct factors also include surgery complications, using IV medications, and implanted medical devices. Less direct risk factors can be comorbid conditions and age.
Doctor, I'm scared. What do I do?
Don't worry, there are so many different treatments.
Some staph infections do not require any treatment and are self-limiting. However, staph infections can be treated with oral antibiotics, or in Miguel's case, topical antibiotics can be applied to the skin. More severe cases might require small incisions to be made to drain the infected site. Severe infections may also require IV antibiotics.
Ah, these braces hurt. The cut's getting deeper. And my eyes, they're getting red. Hurt.
I'm gonna have my student nurse, Donna, check you out right now.
Nurse.
Miguel, what's good, bro?
Wait, Donna, what are you doing? Wait, what are you doing?
Why?
He's sick.
No way, bro. I'm so sorry, brother. Like, what's going on, bro? I'm so sorry about that.
Infections in the clinic usually occur through direct contact, such as through physical contact with the skin, wounds, or contaminated objects. As you can see, Donna, the student nurse, was careless and did not change her gloves or wash her hands before touching her face. As a healthcare professional, it is important to remember that sanitation is key to preventing the spread of microbes and maintaining a safe hospital environment.
You may be wondering, how did Donna end up like this? Well, believe it or not, Donna now also has a staph infection, but at a much more dangerous level than Miguel. The symptoms she is experiencing include chills, fever, and difficulty breathing. As you can see, Donna is now at the hospital because she has pneumonia. When Donna dapped up Miguel and touched her nose without changing her gloves, the bacteria traveled from Miguel's hand to Donna's nose and into her respiratory tract. Although this kind of staph infection is more rare, it is important to realize the possibilities of these infections as a healthcare worker and to take proper precautions to prevent the spread of microbes in the hospital.
Hey, Doc.
Oh, Donna, these are the prevention strategies you should have followed.
Miguel should have properly sanitized his wound with an alcohol swab and used a band-aid to cover it up to prevent an infection. Donna should have changed her contaminated gloves and washed her hands thoroughly, as well as avoiding touching her face to prevent an infection. Because of its length, wearing a tie to the hospital can actually increase the spread of bacteria while doctors are going from patient to patient. As a healthcare professional, try to avoid wearing those loose garments to work.
If you or your patient is coughing and sneezing, consider providing a mask for them to wear to reduce droplet spreading, especially in public settings. Sharing items like paper towels after someone else has already used them is a way to get infected with Staph aureus. Avoid using previously contaminated items. Surfaces should be properly sanitized to avoid cross-contamination with other people in case an infected individual has come into contact with these surfaces.
My bad.